And then, so you're able to see that screen?
Yeah.
Okay, so that is the Moodle book that I've put together. I'm just trying to move this out of my way a little bit. So in the Moodle book, we have got the learning outcomes, and you will see that here we again address the statistics, and that says statistics around how good you are at discriminating whether images are normal or whether they are abnormal, and then of course writing your own comments and then comparing that to that of a radiologist. You will be applying again logical method. So you remember that ABC that we talked about when you evaluate the images. And as I said, we're going to look at the shoulder and the upper limb and the spine, and then generate images also with some common conditions. And then of course, right, sorry, I'm very sorry, but I think I've actually copied a CT thing in here, so excuse me for that. I'll have to fix that one up. You don't do CT. So I'll have to just fix up that page. Let me just make sure, because I'm working between a number of documents. Okay. So in terms of the overall introduction for this unit, again, it will be myself and Tony. You'll have the Moodle book available and some recordings. And as I've already mentioned, 15 clinical cases will be required. And you can use those same 15 clinical cases to populate your self-auditing record. And the submission deadline for that is the last assessment, is on the 4th of December. It's a Friday, so 5 to 12 that evening is the latest that you need to submit it. And near the time, I will provide a Dropbox for the submission of your clinical cases. So the overall marks is 60. Each case is more or less 100 words, as I said, and you should cover the cervical spine, the shoulder, and the upper limbs. You can provide references to support some of your discussion. And what you need to include in the cases is the clinical indication. So if there's something about the mechanism of injury, that should be included. And then to include de-identified images. So it could be 1 or 2. You don't need to include 10. Keep it as limited as possible to about 3 or 4. And then write up a preliminary image evaluation. So what we're looking at with the preliminary image evaluation is actually your kind of summary of support that you're going to write, and then compare that to the radiologist's report. And so if applicable, you can also mention the immediate management of the patient, but the first 4, that's the important ones to look at. So on the clinical marking rubric, so the main thing is the discussion of the presenting symptoms and so forth, and then an appropriate description of the radiographic appearances to include your ABC strategy. So when you write up that part, you don't have to go through the whole ABC. Mention, for example, if it is a case that has pathology and the alignment is affected, then you write about the alignment. If the bone has been fractured, you write about the bone, but you don't need to go through the adequacy is fine, you know, that whole ABC, because there's a limit to the word count. And then compare your preliminary image evaluation to that of the radiologist's report. Now, if you, for example, have correctly identified the pathology and it's in line with the radiologist, then it's a 1 mark in total. However, say, for example, if, say it is a wrist, and you've identified a fracture, however, the radiologist also identifies a fracture, but in addition, there's a dislocation and you haven't picked up on the dislocation, then you award yourself half a mark. So you shouldn't ignore what is the rest of the radiologist. on the other hand, sometimes in the radiologist's report, they might include the acute findings, but also some degenerative findings. They might say something about there's arthritic changes or things like that. You don't have to look at those other findings, which is not related to the clinical question, because otherwise you will get yourself into 0.25 or something like that. So the main thing is, with your preliminary image evaluation, is to answer the clinical question and relate that part to the radiologist's report, because quite often they will add much more detail than is what is expected from you. And then if you include images, all of those images have to be de-identified. So remove any identification, the name of the doctor or the hospital, all of that needs to be removed, so that you only have images with no other identification except for a marker. And then in total, the total marks for each case will be 4 marks in total. So any questions around that? Does it make sense?
Imelda, what do those 4 marks mean in the end? Because you're relying on our honesty to mark ourselves by the sounds of it there.
Absolutely. It's called self-auditing. And also when you submit your work, the form that you're going to submit, you're actually going to sign that you are not plagiarizing, that this is your own work. So in terms of your own work, the preliminary image evaluation should be done before you see the radiologist's report. So that's what it is. We can't police every student, but we do rely on the student's honesty, because at the end of the day is when you do courses like this, you want to see what is a true reflection of your learning throughout the unit. Does that make sense, David?
Yes, so those marks will end up being a mark for this
assignment. So at the end,
assignment?
There's 2 parts to it. So we have the cases, and then we have got the one where you're going to do the PIE record, and that marking is different. That gets added, and then it's weighted down to 25% in total. Okay.
No worries.
Melda, what happens if the radiographer identifies something and the radiologist reports it as normal, yet there is still a pathology there?
So if there is, what we have done in the past, not as much here, but where I was actually studying, if you identify something and the radiologist doesn't identify it, then there should be a third person who actually writes this up.
Okay.
Yeah. So in terms of that comparison, there should be a third unbiased person who actually, even if they contradict, the radiologist provides that this is the actual report. And we've had it in some of the cases that we got from some of the clinical centers, where there is an addendum to the radiologist's report, which actually stated then on consulting with someone else, this in addition was identified. But there should be some evidence that there is an additional fracture or additional pathology that's related to the clinical question.
Thank you.
And then for you, if you correctly identify, that will be a true positive, so then you get the full mark there. Okay? Any other questions around this? Okay. So now the next part is the self-auditing PIE record, and that's where, with all of these cases, we rely on the integrity of the students. So again, 15 reports. So you can use the same reports that you've done for the cases to populate the spreadsheet. And again, having a range of body, you need a range of body areas, but you also need a range of normal and abnormal. Because at the end of the day, you've got to work out the true positive, you've got to work out the true negative, so what is normal, and then also the false positives or the false negatives. Now in 4502, I did put up a presentation with some basic statistics just to go over that, and I've uploaded that again on the units. just for you to refresh your memory if needed. And for the 15 cases that you upload, you'll get 1 mark for each of those cases. So that's 15 marks. When you work out the statistics around the sensitivity, which is how good you are in identifying what is abnormal, and the specificity is how good you are at identifying the normal, so not overcalling, and the accuracy, so that in total is 6 marks, so 2 marks for each of those calculations. And then 4 marks for a brief reflection on your personal abilities in terms of image interpretation. And it could be something where you find that when cases are normal, you tend to think it's abnormal. And I think it's a natural thing if someone is referred, that you overcall in terms of a normal case. You identify a few cases as actually being abnormal, whereas it could have been a normal variant, for example. So those kind of things, or that you are good at adult ALBAs, but you struggle with pediatric ALBAs. So it's that kind of reflection you want to see. So areas where you think you can still improve on, or that you find that you are really good. So you can say my sensitivity in identifying certain pathologies is really good, and that's a confidence boost as well. So just a short paragraph on what on reflection after you have worked out the PIE record. And as I said, when you allocate the true negative, true positive, you can use fractions. And for that, I say use your own judgment, because as I said, the radiologist report sometimes has additional information that's not related to the clinical question. So you can ignore part of the radiologist report, but then just mark yourself against the pertinent things that is important. And then I've got a spreadsheet that I will also show you. So once you've got all of your cases, so for example, C-spine, you will then allocate, is it a true positive, or is it true negative, or false positive, or false negative? And in the end, you will add all of those up, and that will give you the number for each of the true positive and so forth. And then you put it into a 2x2 table, and we went over the 2x2 table with 4502. So you can go back to that statistics. Now you could keep it very simple and just keep it to that it's definitely abnormal, or definitely normal, or that there is a false negative or a false positive. So this is what your 2x2 table should look like, so that you have numbers in each of those once you have completed all of your cases and you've put it into the spreadsheet, and then you work out the sensitivity. And this, you have got the formulas to work that out. So with the sensitivity, the main thing is to get all of it as close to 100% as possible, but it's never possible to get a true 100%. And we know that if we look at radiologists as well, in terms of their sensitivity and specificity. I think, Anthony, it sits around about 97% or sometimes 95 plus, Anthony, Tony? So with sensitivity, then it's identifying the abnormals and having as few as possible false negatives. So where you don't pick up on the abnormalities, and then with the specificity is to be able to identify normals and have very few false positives. So false positives where you say there is pathology, but there isn't. And the reason why you need to have a good specificity is if you would find yourself working in an environment where you might be the sole radiographer, for example, or you're working night duty, and a junior doctor comes and asks your opinion, and you say, I think there's something wrong, and maybe there's not a radiologist around, there might be, this patient might then be referred for additional imaging or something like that. So it's the risk of having unnecessary treatment if you have a low specificity. And then to work out the accuracy, so the overall accuracy which is the true positive plus your true negatives, and that is then divided over the number of patients that were studied. Any questions around that? Okay, so I'm going to close this one and then move on to the next one, which is there's a guidance document that I've put up. Are you able to see that? The Word document?
Not yet.
Okay, I probably need to first stop sharing and then start sharing again. Let me just start sharing that.
Yep.
Okay, you're able to see that now. Okay. So this is just a summary to bring everything together. You need 15 cases with body regions, all the body regions covered, having the clinical indications or symptoms, and that is how the marks will be applied for each of those cases. And then also if there has, consider whether there's any past imaging or history that's pertinent to that case, and then to provide your de-identified images, and then provide the PIE report, and that will be 1 mark, and the comparison to the radiologist's report is another mark as well. Yeah, so that is that guidance document. That's just to put everything together for you if you want to have a quick overview. And then let me just share again the next one. Can you see that one? Not, it says self-auditing of practice cases.
Yep.
Sorry, I thought you couldn't see it. Okay. Oh, why does it want to move on? Okay, there we go. So this is just again a summary, putting it all together, 15 cases, the body regions, the PIE report that you need to do, and the calculations that you need to do, and also the marks that you will get for those cases, how you allocate the different calculations and using the formulas. And then in this slide, you can then add more lines to that. So you can add more rows so that you can include 15 cases. I've just put there as an example. And then again, just the decision-making sensitivity and the summary of that. So that is very similar to what I've discussed. The last one is the self-auditing record. I'm not sure if you will be able to see that one. Can you see this, or should I stop sharing? It says self-auditing PIE record. Can you see that?
Not yet.
No.
Okay, let me just quickly go back and share. You can see that now?
Yep.
Okay. So this is the form that you need to submit for the PIE record, where you put your student ID. And this is where you then sign. So you actually have to sign that you've not plagiarized the work of others, and that in any unauthorized collaboration in preparing this document. So what we're looking for is your integrity, and that this is going to be your own work. So it's about that PIE record that you need to produce and writing up of the cases. And I've just given a summary again of all of the stuff that I have mentioned, and how you then in this form write it up, add rows, work out the sensitivity and the reflection. So this is the form that you will use to upload your PIE cases. for the PIE record, for the 15 cases, that will be a Word document, and you just need to, in that you will be including all of the images. And I will have different drop boxes for that on the Moodle site. So there will be a drop box for the 15 cases and a drop box then for the PIE record. So you will have 2 submissions that you will need to do for the clinical portfolio. So that's all the information that I've put into the Moodle book. Do you have any questions around that? Because for some of you, it might be new. Does it make sense? Okay. So that is the main thing that we wanted to discuss with you tonight in terms of RAD5108, to make sure that you have a good overview of the unit. And as I said, it's going to be very similar for 5109. So for 5109, then, so if you, once we have finished off with RAD5108, and if David doesn't have any questions because he's not enrolled in 5109, then he can say goodbye to us. And then we can continue with RAD5109. Are there any questions that you want to ask specific to RAD5108?
No, I'm just curious, what's the 5109?
So in 5108, we'll be doing the cervical spine, the shoulder and the upper limb. And for 5109, it will be the thoracic and lumbar spine, the pelvis and the lower limb.
All right, yeah.
Yeah.
I'll be doing that next year. Next
year, yeah. It can become, I think Emma had that experience in semester 1 where she had 2 units. Because of the fact that how the timetable runs, quite often the assessments actually happens in the same week as well. So hats off to you guys. I know you're working hard, especially in the current situation that we have, to still undertake 2 units. But as always, you know, if you need any support, myself and Tony, we are readily available. And even if you feel that you maybe want a face-to-face session, like a Zoom meeting, let us know. But also, we are very much aware that it is really difficult to manage everything, your workload, and then your study as well. So if you do find that you are struggling, please let us know. We have got, I think all of the universities have systems in place where you can apply for an extension. So if you find in that week, it's really, like for example, Erin broke a finger now and she can't do the exam. So that is when you contact us, you know, and then there's forms that we need to complete and we can give an extension as well. So don't think because you don't see us physically that you can't contact us. You are our students and we are there to support you in any way that's possible. So please feel free to contact us if there's anything that happens and you find that you are struggling at one point, or even if you just want to chat and you're unsure about something, please feel free to contact us. Okay, so David, no other questions?
No, all good, I think, for now.
Okay. All right, so I'm going to stop the recording